Yeah, we have someone online already. Hi, can you hear me? Yeah, good evening, welcome. To those on YouTube, who do we have here? Who do we have on YouTube? Yeah. Good evening. This is a live Q&A session. Yes, welcome to YouTube. Who do we have here? Good evening. Welcome. Okay, I see you here. Hi, Janice. Good evening. How are you? So I promised that I was going to have a live session tonight on YouTube, and I'm going to take questions from YouTube. Yeah, three people already online on YouTube. If you are not on YouTube, move over to the YouTube platform right now. Let's go. How was your day? It's 8:01 p.m. here in Nigeria, Lagos, Nigeria. And I have decided to have a question and answer session just for YouTube only. Okay, does anybody have a comment? Let's go. So, how was your day? How have you been? Talk to me, talk to me. So many people have been asking me questions, like they want to ask questions and they want me to respond. I think I see something here. Yeah, good evening. I see you. Yes, good evening, daughter of Zion. Victor Joy is here. Good evening. I would have to disappear from TikTok and concentrate on YouTube. Yes, I will have to concentrate just on YouTube. It's like the people on TikTok are just listening to me. So Victor Joy, how are you? Daughter of Zion, hi, how are you? Okay, let's go. Yes, I see your comments. Okay, nice. So many people have been telling me they want to ask me questions, they want to um send their comments and they want my response. And I told them that tonight we're going to have a YouTube live session today. And this is why I'm here. And I hope that I'm doing very well. And I hope that we can interact tonight. Yeah. Okay. Yeah, let's go. Let's go. So, who do I have on YouTube with me tonight? Talk to me. Talk to me. Let's go. Talk to me. Nobody's here. Let me see something. Okay. Okay. Oh yeah, nobody's asking any stuff today. You want me to talk? I'm here. Oh. I'm here. Oh. Let's gist. Let's gist. Let's gist. Yeah, let's gist. Yeah, let's gist. Who do we have? Yeah, let's gist. Let's gist. Let's gist. Oh yeah, let's gist. Let's gist. Let's gist. Let's gist. No comments. Nobody. Okay. Okay. Let's see. They are coming. Okay. For now, let's interact then. Where are you joining me from? Doc, are you okay? Like you look tired. I'm fine. I'm fine. I'm doing very well. Trust me. I'm okay. Just been busy, right? Just been busy. Yeah. Okay. Drop your questions. Drop your questions in the comment section. I'm waiting. I'm waiting. I'm waiting. I'm waiting. I'm waiting. Which one should I use? Let me change this color. Let me change the color. Okay. Let's do this. Yeah. But there's nobody online, no. They are just leaving me and you here tonight. Like I said, this is this is the issue. Or how do you pronounce it? This is the issue. Okay, let me see if I can do this. Okay. Oh yeah. Okay, people are joining us, right? Yeah, let's go. Let's talk. Let's talk. Let's gist. Let's gist. Where are the questions? Let the questions start coming in now. I'm waiting for your questions. I'm waiting for your questions. Start sending the questions in. Let's go. Yeah. Nobody's asking anything. Should we call it a day? We spent over 7 minutes here and we're just like waiting. Doctor, can a woman okay. I see one question here. So you're asking, can a woman that does not ovulate get pregnant? A woman who does not ovulate will not get pregnant. You know why? Ovulation is important for pregnancy to occur. If a woman does not ovulate, it simply means that there is no egg for the sperm to fertilize. It's only when the sperm fertilizes the egg that pregnancy occurs. So if a woman does not ovulate, huh? If a woman does not ovulate, she um she's gonna find it difficult to get pregnant. Hmm? Okay. Do you understand? Victor Joy, do you understand? Yeah. If she doesn't ovulate, then where will she get the egg for baby to form? Is that clear? And this is why we tell women to calculate their ovulation, to know the signs of ovulation. This is very important because if there is no egg and then there is nothing the sperm can fertilize to form the baby. So a woman needs to ovulate for her to get pregnant. Yeah. Okay, so what's the next question? So let me say this. Let me drop this. This is my disclaimer here. For those that are just coming, we do not prescribe online. We don't make diagnosis online. Very important. This is my disclaimer. No prescription online and no diagnosis online. So if you are here and you're trying to look for prescription or looking for a diagnosis, I'm sorry, we don't do that online. Is that clear? For those that are joining the live stream for the very first time, we don't prescribe. Very good. Okay. So let's go here. How do I treat Qatar? Okay, I just responded to that. My daughter under 2 years has kata. Seriously, please can you help? Ebere, you would have to take her to the hospital. You understand? Yes. What if there is no sign? Okay. What if there is no sign of ovulation? I have made a video on YouTube. I have a video, Joy, on YouTube. The title of the video talks about the signs of ovulation. I also made another video, how to calculate your ovulation. So I explained in that video how to calculate your ovulation and the things you need to do. So if a woman is not seeing the signs of ovulation, there are some other stuff she needs to do. So I would encourage you to take out your time on this YouTube platform to watch the video. Why would a woman get recurring yeast infection? There are so many reasons a woman can get and will make her have yeast infection. So many of them. Number one is that okay, but I think we spoke about this the last time we had a live session on YouTube. Some women have erased their normal microorganisms around that area. I believe you're talking about recurrent yeast infection around the vagina. Yes, causing vaginal candidiasis. For some ladies, they have actually deleted or killed the normal microflora there. So this other yeast multiplies. And you see this in ladies who take antibiotics every time, ladies who prescribe antibiotics for themselves. That is one. And then ladies who recurrently douche. You know what they call douching? She applies stuff inside her and she cleans every time. This stuff can also give her recurrent yeast infection. And then ladies who have developed resistance can have recurrent yeast infection. Or ladies who are managing themselves. Some ladies don't like going to the hospital. They like sitting at home, going to the internet to look for the solutions to their problem. Sometimes these ladies might actually mismanage their problem and then come down with recurrent yeast infection. So you say even after getting treatment, yes, sometimes they might have developed resistance. Resistance. So it's better they see a clinical microbiologist to carry out certain tests so that they can prescribe the right medications. But some ladies have developed resistance. Suleiman, how are you? There's some women, they don't see signs. Yes, it's in the video. Victor Joy, I made the video. It's in the video. Yeah, I included that in the video. Some women don't see the signs. So what you can do for me is that when you are less busy, go to my YouTube page, this YouTube page, and watch the video, how to calculate your ovulation and the signs of ovulation. Watch it. Beatrice, hi, good evening. You have watched it. Good. You notice I mentioned that some ladies don't see signs. Some ladies would not see the signs, yet they are ovulating. Do you understand? They are ovulating because um, you don't see any sign does not mean that you are not ovulating. No. Some ladies have no signs, but they are still ovulating. Very good. Welcome everybody. How are you? Please like this live stream. Click on the like button so that YouTube can share this live to other people online. Click on the like button, please. Okay, 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 okay. Yeah, let's go, let's go, let's go. So bring in your questions, bring in your questions, bring in your questions, bring in your questions, bring in your questions. Okay. What again? I see. Yeah, drop your questions in the comment box, please. So let's go. Well, I'm waiting. Sulaiman, are you here? 9 people on the live stream tonight. 9. Okay, please. So ask your questions. Let's go. Drop your questions. all the questions that doctor, how can one conceive twins? Ha ha ha. How can one conceive twins? I believe you can hear me, right? Okay. I made a video. I made a video concerning this. I made a video concerning this on on TikTok, but I don't know if I posted the video on YouTube. If you want to conceive twins, you can actually conceive twins. So, but excuse me, but you have to go for IVF. You have to go for IVF. If you really want to conceive twins, then you have to go for IVF. That is how you can conceive twins. Or you see a fertility specialist, then they can now decide what to give to you. But saying that you will stay at home and then you will give birth to twins, most especially if there's no chance of you giving birth to twins. So if you want to give birth to twins, you will need to see a fertility specialist. Is that clear? But yeah, drop your questions. Drop your questions. Funsho Bola, hi, how are you? Please click on the like button. Click on the like, so that YouTube can share this live stream to other people. Click on the like button. Yeah. Do you understand what I said, Ibere? But you understand what I said, Abby? That if you want to give birth to twins, you will have to see a fertility specialist. Don't go and take any medication on your own. No. You might just give yourself complications. Yeah. Okay, let's see. We have another question here. We have 8 people on YouTube. Drop your questions for me on YouTube. Drop your questions. Okay, I see Destiny here. Destiny, hi, how are you? Good evening. Welcome. This live session was actually requested for, and that is why I said let's talk about any question you have. Drop your questions here for me tonight on YouTube, and I'll take them. I'm not taking any question on any other platform other than YouTube. Somebody says, I have watched the video of ovulation calculator, but I can't still help out. I can't still help me out. So what is the problem? What exactly is the issue? Please talk to me. Michael Chacha. What exactly is the problem? What exactly is the problem? Talk to me. Oh yeah, well, let's go. Talk to me. Talk to me. What exactly is the issue, Michael Chacha? How many times can someone do X-ray due to the radiation? Funsho Bola, if you don't have any need for X-ray, your doctor would not send you for X-ray. Understand? If you don't have the need for an X-ray, your doctor would not request for X-ray. Does that make sense? And it's not advisable for you to expose yourself to radiation on your own. It's not advisable for you to expose yourself to radiation on your own. So if you have a problem, Funsho, I think your doctor would actually tell you the test to do. If there's a need for X-ray, they will tell you. If there is no need, they will not tell you to go for an X-ray. You understand, Abby? Yep. Okay. Yeah, let's go. So drop your questions. Drop your questions. Drop your questions. Those on other platforms, let me do something. Can actually listen. Let's do this. Those on other platform can actually listen. That is what we can do tonight. But okay. Okay, drop your questions. Drop your questions. Let's go. Drop your questions. Okay. As part of job interview, people do X-ray. Yes, yes, but that does not mean you do X-ray every month, Victor. Abi, Victor. Yes, I know that people go for job interview, pre-employment screening now. Abi, But that does not mean you're going to be going for X-ray every month, January, February, March, April, May, June, July. No, it doesn't work that way. And what that simply means is that the amount of rays that will cause you problem, you will never be exposed to that same amount. The only people that might be exposed to radiation are those that work in that environment. The only people that that might likely come down with problems eh, attached to X-ray or the radiation are those who work in that area. Yeah, because they are exposed to the dose every day. In a situation whereby the X-ray is not clear, okay, so what about it? Eight people on YouTube. Eight people on YouTube. So you're saying Funshaw Bola, in a situation whereby the X-ray is not clear. Okay, so what about it? If the X-ray is not clear, yeah, what about it? Talk to me. Talk to me. Yes. If you have any questions, drop your questions on the YouTube live. You can join me on YouTube live and drop your questions. Okay, let's go. I see. So, Funsho, can you please tell me what you mean by the X-ray is not clear? Whereby the X-ray is not clear, e.g. the you're saying this is abdomen. You're trying to write abdomen here. Okay, I'm waiting. Tell me. Good evening. We have somebody here, Beatrice Daniel. Good evening, doc. Someone's vaginal pH is too high. Is it possible to get pregnant, please? Who? I don't get it. Wait first. So please drop in the comment section. Why are you testing the vaginal pH? Why are you testing the vaginal pH exactly? What happened? Why are you testing the vaginal pH? pH. I know what I'm saying because we all understand that and the pH can be acidic or can be alkaline. But why are you testing the vaginal pH? As long as your partner has deposited inside of you and the sperm travels into the cervix, at least you have bypassed the the environment of the vagina. You've bypassed it. If you don't have any problem, as long as the sperm cells are viable and they have gotten in, you can get pregnant. You can get pregnant. What I think is happening is that maybe you are trying to diagnose yourself, or I don't know, or you are looking for the solution on your own. Am I right? I'm just saying. So drop in the comment section. Drop in the comment section. Drop the comment there. I want to see it. Huh? Yeah, let's go. Oh yeah, talk to me. Talk to me. I'm waiting. I'm waiting. We have eight people on the live stream on YouTube. I have decided to be online also on TikTok, but we'll be taking all the questions from YouTube. It's more interactive here, doing the Q&A. TikTok is it's just another world altogether. They block your comments, so I just want to bypass them tonight. Okay, so no comments. Are we okay? Beatrice Daniel, no comments. Okay, nine. We have nine people in the house tonight on YouTube. You can click on the like button, please. Click on the like button. Click on the like button so that YouTube will show this live to more people. So he's asking us another question here. Doc, please, what causes finger infection on someone's hand, and how can we cure it? I was told to take Tabacil Fongotab. I stopped taking the drug at some point and it got back. Okay, so this is what we do here. Um, this is what we do here. Remember, we don't prescribe online. We don't make diagnosis online. No prescription, no diagnosis online. If the drug was prescribed to you by your doctor and you stopped it, it's better you go back. But if that drug was prescribed to you by someone who is not a health professional, and I won't tell you to take the medication. Do you understand? Yes, there are so many infections that can affect the hands. So when you mention the hand, I don't even know what you mean by hand. Is it the finger? Is it the palm? The hand? The arm? So if you have an infection of the hand, then it's important that you um, you see your doctor. No prescription online. We have 12 people on YouTube Live. 12 people on YouTube Live. Doc, why do you get headache before and after period? What can you do to help? This is a very good question. Oh, this is a very good question. Okay. You know that when a woman gets close to her period, hormones, the whole process of menstruation is tied to hormones. Now, when these hormone changes occur, some ladies feel headache. It's a normal process for them. Some ladies, whenever it's time for them to get close to their period, they have these hormonal changes and then they come down with headaches. Doesn't mean that there's anything wrong with you. It's just part of um, your normal body process going into menstruation. What can you do to help? Well, what you can do to help yourself is that you can take analgesics, really, yeah, can help you. And then you can also take fluid to help you. Hmm? Yeah. Okay. Yep. Okay, I have another question here. Um, Please, what can someone do when a child is convulsing? Patrick is said do. Okay, when a child is convulsing, as Africans, we know that Africans they put spoon in the mouth of the child that's convulsing. Sometimes they cut onions. Sometimes they will tell the mother to urinate over the baby. Those stuffs don't work. When a child is convulsing, the first thing to do is to remain calm, please. The convulsion will not kill the child. It will not kill the child. I'm speaking as a professional. It won't kill the child. All you have to do is remain calm. If the child is in an environment that might cause harm to the child, take the child away from that environment. This convulsion, after a while, stops on its own. But there's a certain form of convulsion that continues on ending, continues. So if a child is convulsing at home, 1, 2, 3 minutes, it stops. Whether you give or you don't give anything, you put spoon or you don't put spoon, it will stop. Then take the child to the hospital. But it's hard. It's very hard. It's very hard because there is panic at home. There is fear. Whenever a child is convulsing, people tell you, the child will die. The child should not bite, should not close the teeth. If I wasn't a doctor, I would also say the same thing. But the child will not die. Biting the teeth does not mean the child will die. No. It means the body is contracting. When there's convulsion, the whole body, the muscles are contracting. The muscles of the jaw contract. So the teeth closes also together. The hands become stiff. After a while, it relaxes. So take the child to the hospital and let them check the child. At home, and there is no medication you can actually give that child when the child is convulsing at home to stop the convulsion. So remain calm, support the head of the child. Most times, when the child relaxes after the convulsion, you notice that the child sleeps off, becomes tired, and what again? And sometimes they might urinate on the body too. Yes. Yeah, Gloria is asking me a question here. Can someone can someone's tube be blocked and they still see their period? Yes, you can still see your period. You know that there are some women who don't ovulate and they still see their period. It's called anovulation. The woman is not ovulating, no, but she's still seeing her period. Remember, period is tied to hormones. Hmm? Your period to hormones in the body. As long as these hormonal changes occur, the change in the uterus will also occur, and she would menstruate. Hey, life issues with Jesse. Good evening. How are you? Welcome. Doctor, please, can you say something about tyrotropine? Tyrotropine is something they give to people when they have issues with thyroid. It relates to the thyroid, the whole thyroid hormone. Yes. So tyrotropine is it's along. Let me see. Let me put my head together. Tyrotropine. Yeah. So we have is it tyrotropine? Yes. Now is it tyrotropine? Yes. It has to do with thyroid generally, but right now I can't seem to figure it out exactly. But tyrotropine talks about the whole process with the thyroid and the thyroid hormones. Um, so that I don't say rubbish. Allow me just leave that so that I don't say rubbish. When my brain is refreshed or I get to go through the text again, then I can answer you. Sir, my period changed from 28 to 35 days, so I can calculate my ovulation. You want to get pregnant. Okay. Did you watch the video on YouTube? That's my video on YouTube on how to calculate your ovulation, right? Did you watch the video? Um, is it Michelle or Michael Chacha? Did you watch the video on how to calculate your ovulation? Um, Doc, is it possible to get pregnant without ovulation? I said this before, Olabisi. Ovulate. There is no way she will get pregnant. Oh, sorry, the light is gonna be back. I'm sorry. If a woman does not ovulate, uh, okay, we're back. If a woman does not ovulate, there is no way the sperm would fertilize. What would the sperm fertilize, please, to form the baby? The sperm, when a man releases inside a woman, the sperm travels, abi, good, goes to look for the egg. If there is no egg in the woman, there will be no baby now. Do you understand? There will be no baby. So they all work together. There has to be a sperm, viable sperm, a sperm that is functioning, that is mobile, that can travel, and then there has to be an egg. So the sperm will travel and meet the egg. When the sperm meets the egg, fertilization occurs. So if there is no ovulation, then there will be no fertilization, no pregnancy. I mean HSG, hysterosalpingography X-ray. Okay. Wait, oh, Funsho Bola, who sent you for HSG? If you did an HSG, the result should be with your doctor. Your doctor will interpret the results. You don't have to bother yourself about the result not being clear. Leave that. Don't worry. As long as you have done HSG, there's something they look for or we look for when you carry out HSG, and it's going to be very clear when you do the HSG. So your job should not be, it's not clear. Why? Should we repeat it? No. Is that okay? I want to conceive a baby boy. The video is on my YouTube page. Michael Chacha. I made a video. How many minutes? About 15 minutes on YouTube. How to conceive a baby boy or a baby girl. Have you watched the video? How to conceive a baby boy or baby girl? Have you watched it? It's on YouTube. Oh. So many people disturbed me for that video. It took me a while, but I made the video and there were some little backlashes, especially from TikTok. But that didn't stop me. The video is there. You can watch it. Over 2,000 views. So watch the video and you will know what to do. Please watch the video. Trust me. Doc, please, what are the causes of repeated sore throats? Sore throats. Ah, You should not be having repeated sore throat. Oh, if you are having repeated sore throat, it's not normal. Oh, you should not be having repeated sore throat. It means you are having recurrent infection, repeated recurrent. So it could be immunosuppression, it could be recurrent bacterial infection, and so many other stuffs. Do you understand? When you're having recurrent sore throats, either you're having resistance, immunosuppression, repeated bacterial infection. Huh? Okay. Somebody's asking, okay, is there a guarantee that a woman will get pregnant if she has sex during her ovulation? That's when she's having that clear slimy discharge. Okay, very good question. When a woman meets her partner and she's on her ovulation that day, the chances of her getting pregnant is very, very high. Very, very high. Very high. All things being equal, she's fine. Her tubes are not blocked. Um, there is no structural abnormality. The partner sperm cells are good. They are active, adequate number of sperm cells, and she's on her ovulation. My dear, yes, there's a very, very high chance that she will get pregnant. The reason why I'm saying all things being equal is that some people still engage in intercourse during their ovulation and they don't get pregnant. It means that there are one or two factors involved. But if everything is intact and everything is fine, if a woman meets her partner during her ovulation, she will get pregnant. And this is why you will see young girls tell you that I have been having intercourse. I'm not pregnant. Sometimes you are having intercourse at the wrong time. At the wrong time. Someone is saying, Patrick is saying, I attended a seminar and the tutor said HIV cannot be contracted through oral sex. Not true. Just asking for a friend. Yes, yes, yes. The amount of virus in the saliva to give you an infection is so low, unless uh unless the fellow has wound ulcers in the mouth. Do you understand? Wound in the mouth has cuts that can allow enough transmission of body fluids. But we spoke about HIV on Sunday, this Sunday. Yes, we spoke about HIV online. So yeah, the person is correct. Somebody's asking me, Victor is asking, talking about ovulation, how can people with polycystic ovarian syndrome know their exact fertile days since their cycle is most times not stable? Very good question, Victor. Most times, people with PCOS, it's important they know the signs of ovulation. Oh. Every woman should at least try to know the signs of ovulation. I made a video concerning that on YouTube. Yes. Um, Number one, you know the sign of ovulation. Number two, you can also use the ovulation prediction kits to test yourself. But if you know the signs of ovulation, it will help you to know that, excuse me, to know that something is happening. My body system has changed. Somebody is saying what? I don't really know what to do. That is my only sickness. It come and go. Are you talking about the sore throat? If you are having recurring sore throat, I am happy. Recurring sore throats, you know what to do now. Let me show you. Let me tell you something. In case you missed it, um, have you seen this? Yeah, good. If you're having recurrent sore throats, recurrent every time sore throats, you should not be looking for the answer online or on Google or going to live sessions looking for somebody to prescribe medications for you because they will just prescribe rubbish for you. You should see your doctor. Recurrent sore throat needs to be investigated. Recurrent. I'm using the word recurrent. That is what you said. You need to see your doctor and they should examine you. Yeah? Very good. Okay, and what's the time? We have 20 minutes more. 20 minutes more on this live stream on YouTube. Yes, this live stream is specifically for YouTube. So for those that have questions, you can drop your questions on YouTube here on the YouTube live, and we'll attend to them. So many people were requesting for this, and that is why we are here tonight. But I don't know. Okay, no more questions. No more. Are we okay? Let's see. Yeah. Okay, we are good. Okay. I'm waiting. Oh, okay. Yes, yes, yes. Let's go. Let's go. Talk to me. Talk to me. Drop your questions. Who else again? This is the most funny thing right now, because by the time you start responding on the other platform, start saying you're not answering me, you're not responding to me. So let's go. Talk to me. Let's go. This me. We still have a few more minutes. 11 people on YouTube. If you are just coming, you are welcome. Drop your questions in the comment section, and I'll do my best to respond to you. Yes. Oh yeah. Let's go. Let's go. Let's go. Let's go. Any comments? Lest I forget. Is that the right word? Least I forgot, or lest I forget. Least I forgot. I want to appreciate all my subscribers on YouTube. I want to thank every one of you. Hmm? I want to thank every one of you. I want to thank every one of you, all my subscribers on YouTube. Thank you very, very much. You guys are the reason why I can actually come on live on YouTube. I have been having body pains and headaches since yesterday. What could be the cause? So it could be stress induced, stress, physical stress, emotional stress, bed stress. It could be due to flu. Your body flu or flu around can make you feel like you're having body pains, you're having headaches. So what you can do for yourself is, if you notice that you have body pains, headache, no body temperature, increase in body temperature and the rest, you can take analgesics to help you, and then rest a while. You should be fine. You understand? Yes. Um. I'm just coming. You are just coming. Welcome. Drop your questions quickly. We have about 15 minutes more on YouTube. Everything I go to the doctor, they only do corona tests. Today, the doctor said I should wait now, the 3 day, before he will know what to do. Where are you? Happy? Happy, where are you, please? Which part of the world are you located right now? I'm just coming. Okay. You're welcome, Lizzie. 14 people on YouTube. Wow. Welcome, everybody. Drop your questions here. All your questions will appear. Every one of them. Okay, and code too. So I've told you what to do. Try doing that. You can also add vitamin C. You can also add vitamin C, yes. What are the short term and long-term side effects of postinor 2 abuse? Patrick said do. I made a video concerning this postinor. I have made about 2 or 3 videos concerning postinor. I have the video on YouTube. I have the video on TikTok. Short-term and long-term side effects. Number one, let's say this, please. Let's say this. Postinor is a medication that is good, but ladies abuse it. They abuse postinor a lot. Now, the common side effects of postinor 2 abuse is problem with your menstrual cycle. So if you abuse postinor, whatever the name is, postinor 2, post pill, early morning, whatever you call it, I don't know their names. Anyone you take and you abuse it, you can have problems with your menstrual cycle. Now, this problem of the menstrual cycle can affect a lady sometimes She find it difficult to get pregnant. Yes. Yeah. Yeah. Somebody say my TikTok comment section was off. Yes, yes, I know. I have body temperature too. It increases and decreases. Okay. Get yourself tested. You know what I mean? Get yourself tested. Get yourself tested. Princess, hi, how are you? Um, oh, I see. Happy. Okay, I see. Now I understand. So this is what you should make your doctor understand, that your sore throat has been recurrent. You know, I'm in Nigeria. Those in Europe are very, very scared of coronavirus right now. They are panicking. Me, I'm not panicking anymore. I don't even regard corona right now. I don't. You know why? I think the whole paparazzi about corona is just too much for those of us in Africa. So if you are having recurrent sore throats, your doctor should check you beyond corona. Yes, they will screen you for corona, true. But at the same time, they should check you for other stuff. What if you don't have coronavirus and it's something else that is wrong with you? So I'm sorry that you are going through this right now, but relax your mind. Yes, they're just being careful. Do you understand? Hmm? Uh, my baby is 2 months and 3 weeks. Why am I not menstruating yet? And can I get pregnant without menstruation? Lizzie, Lizzie. Sometimes, sometimes, um, it's not your fault though. Trust me, it's not your fault. This your question. I have the answer on YouTube. Delayed period, madam. Delayed period. If you have a baby that you are breastfeeding, you just gave birth. Sometimes your period will not come now. At the same time, I have seen a woman who gave birth, breastfeeding her baby, no period. She also took in, oh, she got pregnant. So it's both ways. Do you understand? That is why they will tell women, after giving birth, to go for family planning. If indeed you don't want to get pregnant immediately, the best is to go for what? For family planning. But if you are exclusively breastfeeding, the chances of you getting pregnant during that phase is low, but you might still get pregnant too. This is why they tell women to go for what? For family planning. Good evening. I have scratching on my private parts. Sorry, I'm at work. No problem. Madam. I hope you understand that. I hope you understand what is going on here, right? That we don't prescribe online and we don't make diagnosis online. I hope you know, right? Good. So if you have itching, you have itching around your private area, it's very disturbing. It can be very, very bad. What if it's normal vaginal itching, or it's caused by something else? Do you understand? I can't really take a history from you online. Do you get? Yeah, yeah. I know you really, really want the solution, but we can't give you solution online, especially when you have issues with your private region. The best thing to do is get or speak with your doctor privately. Speak with your doctor privately. Yeah, we need to find out more about this your itching. Let me tell you what I mean by that. We need to find out when it started. We need to find out um, other symptoms. We need to find out. There's a lot to find out. There's a lot to find out, and I don't want you to start dropping those information for me online. You get? Yes. Somebody's asking us again. Is there a solution for a non-ovulating woman? If a woman is not ovulating, what is the solution? Olabisi, the solution lies in the fact that we need to know why, first of all. Why is she not ovulating? That is the most important thing. That is the most important. Why? Is it because um, she's on medication? Is it because she has PCOS? Is it because she has hormonal imbalance? Is it because she has extreme weight? So many things can make a woman not ovulate. You need to know why. When you know why, then you can now know how to correct it. Does that make sense? You can't just say, Doctor, I'm not ovulating. What drugs can I take? Go and buy this. When I don't even know why you're not ovulating. There are so many reasons why a woman will not ovulate. So I think the best thing to do is for us to find out why, number one, and then we can now, your doctor can now prescribe for you. Okay, we have a question here. What is the cause of cyst period for 4 years in a lady of 48? This answer is on my YouTube channel. Princess. Yes, it's on my YouTube channel. Yes, it's on my YouTube channel. So look for the video titled Delayed Period. Look for the video titled Delayed Period. The answer is clearly spelled out. I don't want to mention anything here so that I don't make you sad, or maybe your friend is listening and then your friend feels sad. You understand? When you watch that video, the answer is very clear there. Cease period for 4 years in a 48-year-old lady. You get, right? So watch the video. Delayed period. That is the title of the video. Then you will see it. I beg. Yep. Good evening, Oladikbo. How are you, Baba? Yes, I see you. Welcome. We have few more minutes and then we'll be done tonight. Good evening, Doc. Can a pregnant woman in second trimester donate blood? Why should she be donating blood? Please, why? Why should a pregnant woman be donating blood? Please, why? No. No, get your blood somewhere else. You should go and look for the blood somewhere else, please. I beg you. A pregnant woman, leave her alone. No. Chibuzo. I hope this question you're asking is just question. It's not real, Abby. I hope it's not real. This is just Q&A session. It's not a real stuff. A pregnant woman, why should they be taking her blood? Why is it so bad that we can't get blood somewhere else? We can get blood somewhere else. Please leave the pregnant woman alone. Hmm? Yeah. He did the test, it was negative. He said I have to wait for some time. My dear, I don't know what to say. I'm not going to come online and say something contrary to my Hippocratic oath with regards to me and my colleague, most especially when we feel that those abroad usually know much more than us. But I just feel that they should look beyond COVID, and they should look beyond COVID. I think I'm going to make a video on YouTube and share my COVID-19 experience. I was thinking of making that video, but the thought of making that video scares me because, first of all, the video might be so long. I don't have the device to record such a long video. I wish I could share my COVID-19 experience. The whole paparazzi is just too much for us in Africa. Oh, please, please, for those of us in Africa. I'm not talking about those in Europe. I'm trying to be very, very careful and sensitive of other regions of the world because I know that COVID is still very, very much out there. But those of us in Africa, I wish I could share my experience of COVID. I had COVID twice. Yeah. It's so bad. I can't eat, drink water, even to talk. Nobody's hearing me. Did they prescribe any medication for you? The person is considering it. Let's say I want to believe that the pregnant woman has registered for antenatal. She should go and see her doctor and speak with her doctor before donating any blood, please. She should go and see her doctor and speak with her doctor. If a woman who is pregnant in her second trimester should have registered for antenatal, so she should please see her doctor. We are almost out of time. Can lower abdominal cramps be sign of ovulation without the slimy water? Oh, I have said this times without number, Olabisi. I've said this. The answer is in the video. I made a video now. Abi, you don't want me to make a video again, I should just stop making videos. I have made a video concerning this question. Yes, I made a video concerning this question on YouTube. Signs of ovulation or symptoms of ovulation. What's the title? If I can't remember. There, watch it. Watch it. The answer is there. Though I made the video in Pigeon. You know, I make my videos in Pigeon. uh that is my brand for now. Maybe later I will switch to Pigeon and English. Maybe later. But right now, I make my videos in Pigeon so that at least um, those of us who find it very, very, very awkward listening to some medical big dramas can at least relate. So I made a video on YouTube, signs of ovulation. Please go and watch it. The answer is there, so that you know almost all the signs of ovulation is there. Yeah, they gave him yes, just to stop the pain for now. Okay, I'm sorry, ma'am. I'm so sorry that this is happening to you. I don't know why they are panicking. You shouldn't panic concerning for COVID. Please attend to the patients, treat them, please. Please. Yes, COVID is real. Is real. It's not um false or a myth. COVID is really out there. I had it twice, but at the same time, if you are negative, they should treat you. I'm so sorry that you are going through this pain. Yeah. Okay. Yes. 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 We are almost done tonight with the live session today. We're almost done, and I hope that I was able to respond to your questions. I'm going to be doing these YouTube live sessions from time to time. I'm trying to spend more time on YouTube because TikTok is frustrating my live stream. Like, people sending questions, you can't see their questions. So for those that really have questions to ask me on TikTok, they can join the YouTube live and drop their questions, and then I'll respond to them. I think I enjoy the live session on YouTube. I can see all your questions. I can pin them on the screen, and no matter the length of your question, we can all see it. So, yep, yep, yep. Um, Thanks for tonight. God bless you. God bless you too. Yeah, I want to spend more time on the YouTube live. Yes, I want to be deliberate with the YouTube. Thank you. Yes, I'm happy. Happy. See, my dear, I'm sorry that you're going through pain. Yes, sore throat is very, very bad. But you know now, I can't prescribe for you. It's unethical. It's criminal. It's bad. I don't want them to seize my license. I don't want them to seize my license. That is why. But take your pain, take your analgesics. You can take vitamin C. You can take warm water in the meantime to help you. Take your analgesics, take your vitamin C, take your warm water, and you should be fine. Yep, yep, yep. So thank you to my 1,150 something subscribers today. I made a video for YouTube 2 days ago. I think my subscribers were 1,140 something then. So that video mentioned 1,140 something. But today you're 1,155. And I want to say a very big thank you to every one of you that have subscribed. And I promise to always, as much as I can, come online on YouTube, do YouTube live sessions, answer all your questions, make videos to your questions. Yes, I'm going to do something. You're going to drop questions for me. I'm going to collect all those questions and make a video of all the questions and post on YouTube. Hmm? Yep, I'm going to do that. So thank you once again. And like I always say, good life now waiting. Good life. Good life nonsense. Yes. So if you have questions for me, please, if you have questions, just drop them. Be dropping them under the comment section on the videos. When I'm chanced, I would collect all. Okay, yeah, very good. Take your warm water, very good. I'll collect all the questions. One day I will sit down and respond to all your questions and make a video, respond and post. So make sure you follow me. Oh. Make sure you subscribe and turn on the notification. Thank you very much. And I think I have to go now, Abby. Yeah, yeah, yeah. I'll see you all later. Take care of yourself. And Bye bye. Au revoir. Au d'abo. Kachifo. Yeah. Bye bye.